Good morning, everybody, and welcome to our weekly live broadcast coming to you from Tustin Longevity Center here in Orange County, California. My name is Talon. I'm the practice manager here, and I am here every week with Dr. Rita Ellithorpe, our medical director. Thanks for joining us today.
Always a pleasure.
So if this is your first time joining us, welcome, and we just want to explain we want this to be an interactive event. This is meant to get questions answered from you. And you can ask those questions in the chat section over here in YouTube. You do need to be logged into that. I'm watching for those questions to come in, and I'll ask the doctor those. And of course, you can email your questions into us if you're having any trouble with YouTube. Our email address is office@tlcdoctors.com. That's office@tlcdoctors.com. And in the subject line of that email, just put something in there about questions for YouTube or live Q&A, and they'll make sure that those questions come over to us. And of course, this is meant to be educational information on how we would generally approach your question here in the office if you are sitting with the doctor. But please don't take this as personal medical advice. We do want you to maintain a relationship with your healthcare provider. So follow up with them with these questions as well too. And certainly we're happy to help you here. We are accepting new patients at our office, both in person and via telemedicine. So you can set up a telemedicine appointment if you're here in California with us as well too. Doctor, how are you doing this week?
I am blessed, very blessed.
I am as well. Well, let's kick off, and I do want to mention that you are also here on Monday evenings. We started doing that a couple weeks ago. Dr. Ellithorpe is here on Mondays. She is doing a longer version of this, and she's on YouTube, so you can join her and just her around 5:30 p.m. Pacific time here on Mondays. And we're here every Wednesday at 9:45 a.m. together.
Yeah, I'm really enjoying the Monday visits. It's really a nice way for patients and people just to ask general functional medicine questions and how we might approach them. And so I think it's a good thing, and I hope you share it with your families and like and subscribe.
Yes, please do. All right, well, where do you want to start today? I see you have some information as usual. Do you want to start with some headlines, or should I get into some questions right away?
Let's do questions, because that's the primary reason we're here.
So I will start with a couple questions that were emailed in to us over the last few weeks. I have a question from Sophia that says, I'm a patient of yours and have a couple questions. So I moved out of state, and I'm following a doctor's office that was highly recommended for chelation therapy. It's a naturopathic physicians group in Scottsdale, Arizona. However, when I search for any of the doctors on the Acam site, none of the doctors from this office are listed unless I'm not searching correctly. So first question is, do you recommend only using doctors listed in acam.org?
No, Acam is the parent, the father, the actual first large-scale conglomerate of physicians trying to think outside the box, alternative complementary medicine. They started in 1972, the American Academy for the Advancement of Medicine. They actually started from a smaller group of physicians in the Great Lakes area, where much of the original work and cardiovascular improvement from chelation therapy was noted, and that was called the Great Lakes Academy for the Advancement of Medicine. Then they made it national as the American Academy for this. But that doesn't mean they're the only organization teaching it. So these other gentlemen might have gotten it from the A4M, the American Academy, American Academy
for the Advancement of Medicine.
Yeah, A4M.
Or even IFM.
Yes. Institute of Functional Medicine. So there are other off branches from Acam, and that's probably where they got their training. Also, naturopathic colleges of medicine emphasize intravenous therapies for nutrients, oxidative therapies, and chelation therapy. So their own medical training in their School of Naturopathy probably taught them how to do this.
Right. So it sounds like you've done a little bit of research, and this is a well-reviewed medical office. That's definitely where I'd start. What are other patients saying about this place? How long have they been in business? What are the doctors' backgrounds? But just because they're not listed on the Acam website, which is just a professional organization, doesn't mean that they weren't even trained by Acam, let alone that they're doing anything that we wouldn't approve with. Questions I might ask would be, how long have you been doing chelation therapy, and what kind of chelation therapy are you doing? Just the fact that they're doing is a really good sign. I can tell you here we use 1.5 grams of calcium disodium EDTA, which is just refined, has the broadest effect, and it's the safest. It's a very conservative amount versus a more aggressive amount of EDTA.
Yes, they might be using disodium, ethylene diamine tetracetic acid. So there are other salts of the EDTA, but calcium disodium is, in my opinion, and since I teach it to doctors, the safest.
Right. Okay, so I think that answers the first of Sophia's questions, and the second one is, what is your opinion in using N-Acetyl cysteine supplement regularly or to have on hand as needed? I did not see NAC in the TLC store online. Do you have something comparable?
Yes, I like N-Acetyl cysteine, and I do use it daily myself. It is a precursor to very important antioxidants in our body, so it's a wise supplement to take. We also, I believe we have it as a separate item that you can take. I think it's a 500 milligram capsule, usually recommended as 2 a day.
Right.
I also have it in my TLC metabolic formula and natural DHIS. So it is a very valuable precursor and antioxidant supportive element, usually for respiration. People who get bronchitis, chronic cystic fibrosis, chronic lung disorders like emphysema, they have trouble with expectoration of phlegm. NAC is helpful as an expectorant as well.
So Sophia, I just want to follow up and say, yes, I know that we do have it. We carry NAC by itself from Orthomolecular, and as doctor said, I believe it's 500 milligrams. It sounds like you're having trouble finding that, and I have your email since you emailed me a question. I'll actually email you a link to that product by itself. But as Dr. Arthur also said, it's in a lot of our other formulas as well too, ones that our doctors have created as well as some other ones. And doctor, what would you say, because she did ask about taking it regularly or having on hand as needed, is there an amount that you generally recommend to take just as a preventative versus when and if would you take more NAC if you're suffering?
I think anytime you're under oxidative stress, you're getting a cold, you're burning the candle at both ends, you're working hard around the holiday seasons, flu seasons. Anytime you have a cold and congestion, N-acetylcysteine is very valuable with lung health. So I would do that. You could always call the office 714-544-1521 or send us an email at office@tlcdoctors.com. And we could get that information to you, or they could transfer you over to the supplement department, and they'll help you that way. So I think I like to take it regularly. But yes, you could use it episodically when you have those other conditions of stress or a cold.
Okay.
And what amount? I think 500 is the base milligram dose per day.
Would you ever kick it up if you're suffering?
Yeah, 2 grams a day, 1,000 twice a day.
So a gram is 1,000 milligrams. So if one capsule is going to give you 500 milligrams, doctor's saying you could take 2 capsules, that would be 1 gram, up to maybe 2 grams, which would be 4 capsules. Okay, thanks for that question, Sophia, and I will send you an email after this broadcast. I'm going to hop over to a question that came in on the chat. First question from the chat is from Surichi, and Surichi asks, please suggest some probiotic. I have to start one.
Well, I think you have to understand probiotics can be sold over the counter, and they tend to not be clinically tested. They're usually not viable after a certain period of time. So I choose to work with companies that do assays and viability at the end of the expiration date. So if you go to Orthomolecular and you look at their probiotic 225, the most potent one, and their spectrum of probiotics, that's a powder that you would open the packet, put it in the water, and then drink it right away. They will guarantee at least 225 billion after their expiration date.
Right.
So I like Orthomolecular. Now, if you don't have any real problem, Orthomolecular puts out another product called Orthobiotics.
Right.
That's what I use every day of my life. But I also like the Orthospore IG because there are spores that are very valuable as probiotics, as we're studying the whole microbiome. And actually, I was just in conversation with a gastroenterologist friend of mine last night, and he is moving more and more into functional medicine. And so they appreciate what we have done. We foraged through this for years. And so he's in favor of the probiotics, Orthomolecular and Orthobiotics, Orthospore IG. I also carry another one that's well tested called Essential Probiotics that has maybe a little more of the gram-negative beneficial probiotics. So I am using these cyclically, and I find if you can heal your gut and let those good bacteria help make vitamins for you, help support a good anti-inflammatory microbiome, your mood, your neurotransmitters, your gut lining, leaky gut, all these things are diminished. So I would start with Orthobiotic, 1 or 2 a day. And since I don't know who you are, I would recommend anyone to start with probably Orthospore IG, 1 a day.
Yep. Okay, Surichi. Again, just to recap, if you go into a regular health food store, certainly like a GNC, unfortunately we've just found over many, many years of experience that patients will come in and they're taking large amounts of things that they've been taking for a long time with no results. And that's due to just a lot of junk out there that's just marketed as, without it being backed by clinical studies or experience. So we've chosen to work with companies that do such and we can trust. Orthomolecular is probably the foremost one that we work with. And Dr. E mentioned there's a lot of different probiotics that we carry and recommend. It depends on what the patient may be suffering from or what the end goal is. If we're trying to kick a patient into high gear and recoup some health that was lost in the gut due to maybe antibiotics, we're going to start them on a high dose like probiotic 225. But the daily one that Dr. Ellithorpe mentioned, that's just your good one that you should take daily, would be like Orthobiotic. Yeah. Okay, we have another question that was emailed into us here. This one's from Lori, and Lori asks, can the doctor share more about what women who start on progesterone can expect in terms of overall improvements, and also what are the risks to watch for, if any?
Well, I'm all in favor of natural progesterone, and there is no other variety of it. There's just progesterone. The problem comes in the training of medical school, which is funded and managed and directed by the pharmaceutical companies, and that is for creating synthetic type progesterones. Mm-hmm. So you'll hear, and maybe the doctor will not even be aware, even the gynecologist, OBGYN may not be aware of this. But progestins are not progesterone. Progestins are synthetic copies that can be patented for making money. And this is where some concerns come in about side effects with progestins. And there are variable problems. Even there are studies that I have read over the years that there's an association link with breast cancer. Now, I don't want to emphasize that because I never use synthetic. I never use birth control. Natural progesterone is unique and to the woman's body. And it is a balancing for the estradiol component of a woman, so that the estradiol will make the uterine lining get fluffy and ready and bloody in case an egg is fertilized to embed into. But if there's no fertilization, then that blood has to get cleaned out, and progesterone is the cleaner outer, you might say. So you might say a natural anti-estrogen is progesterone. Now, progesterone is associated also with helping women sleep. It's associated with enhanced moods, because if you're estrogen dominant, as we age or are under stress, we don't ovulate, and the estradiol can be associated with agitation. So it helps your mood, it helps your bones, it is a osteoblast stimulator for bone health. So progesterone has so many benefits. All the negatives have been influenced and corrupting the literature and the common conversation, because people don't get enough chemistry, organic chemistry, prior to medical school, and they get taken down the road of pharmaceuticals. So I have nothing negative to say about natural progesterone. I have only positives. And as I'm approaching 70 soon, I use progesterone just this morning, So I use my estradiol, my progesterone to help my skin, my hair, my bones, my sleep, my immune system, my cardiovascular system, with natural hormone replacement therapy.
Great.
Helps my memory too.
And is it true that women who are still ovulating can even use natural progesterone as a form of birth control?
Yes. Even you never know when you're not going to ovulate. So if you get upset, that cortisol stress will block natural luteinizing release follicle stimulating hormones. So I encourage young girls, because it's so stressful today, to use natural progesterone day 15 through 25 of their menstrual cycles all the time, to be an adjunct. It would never upset their natural ovulation. If they want to use it to be a natural birth control, all they would have to do is take that natural progesterone from day 8 of their cycle to day 25 of their cycle, and voila, you have none of the negative side effects of birth control, and you have all the blessings of having a natural birth control.
Okay, great. Hope that answered your question there, Lori. I think we got a quick question here. Is there a cardiologist in Orange County you recommend who is supportive of chelation therapy?
There is, and I have to get his name. I think Dr. Kaur knows his name, okay. Or P.A. Patel. But let's note that and make that an announcement. I asked Dr. Kaur to have him for dinner so I could take him out and we could meet with him. So he is very interested, and I just can't recall his name because I just had this conversation in the past 1 week.
I tell you what, Andre, if you will send me an email, since this question came in on the chat, I'll follow up with you when I get that answer of that name of that cardiologist. You can send an email into office@tlcdoctors.com and then just say follow-up question from YouTube Q&A, and then to my attention, Talon, and I'll get you that information.
Yeah, and Dr. Kaur has his name.
And certainly I'll try to remember to bring that up in our next broadcast here. Okay, I have another question here that says, what are the doctor's recommendations when someone is diagnosed with plaque on the arteries and aneurysms? Someone who has high blood pressure, stress, and genetic heart issues.
Well, that's a lifestyle changing instruction functionally.
Where would you start with a patient like that?
Well, I would put them on a very low carb ketogenic diet, very low carb. I would put them on intermittent fasting so that their body is only dealing with food in a 6-hour window of time every day. And if they could, do it to even a 1 meal a day, that would be better. So getting the glycating impact of sugars and fructose sticking to their walls and their endothelium needs to be brought under control, because all diabetics have advanced cardiovascular disease. So getting the sugar down is number 1. Number 2, drink enough water. Number 3, if you are on a low carb diet, you're going to be naturally eating a richer phospholipid, cell membrane repairing, supple, the cell membrane repairing aspects of having butter and eating meat and fish and chicken with the skin on it, and pork chops and eggs and egg yolks. All those things will help the suppleness with the water. I would take enzymes that are systemic to disinflame the body, because wherever there's inflammation, patchwork and calcium plaques will be developed. I would put them on chelation therapy immediately, once or twice a week until they get 30 done. I would tell them never eat late at night, and I would ask them to start doing some hydraulic cycling, walking every day, or stationary bike or treadmill every day to get that pumping going. And then, of course, if they do have these things cardiovascularly, they need to see a specialist who, depending on how severe this is, if they need other medications for the blood pressure, of course, we could help with that. But I would probably use, if there's concern, a consultant cardiologist at the same time, and work with these lifestyle changes with the cardiologist to see if this will improve, and then maybe get off of some of the medicines over time.
Right. I wonder also if Beamer would help with that. Mm-hmm. Since that really helps open up capillaries, increase circulation. Mm-hmm. Okay, let's see, what other questions do we have here. What is Sylvia is asking, what is a safe alternative and reliable option instead of a mammogram?
Well, there isn't, at least if you're going to go by what are the standards of practicing medicine. Mammogram is what has been deemed the thing to do for women. Now, with mammography is trauma to the breast and radiation to the breast, both of which are linked with breast cancer, okay? So if you're saying, are there other things you could do? Well, a healthy lifestyle. People who live a healthy lifestyle are probably not going to get cancer. If you read Dr. Seyfried's book or watch his YouTube called Cancer is a Mitochondrial Metabolic Disease. So Dr. Seyfried, Seyfried, he is a PhD in looking at oxidative reduction of stress and the low-carb diet and fasting for cancers. And so if you want to address breast health, it isn't just a prescription for a mammogram. It's a doctor who cares about you, teaches the importance of drinking your water, lowering your carbs, exercising a little every day, eating in a narrower window of time, taking natural progesterone and making sure the estrogen in the woman is balanced with the progesterone that's natural, giving her enzymes so she has fibrocystic breast or tenderness, that'll help, and getting her on iodine. Most everyone is iodine deficient, and so the breasts and the thyroid gland, you can get a goiter trying to get enough iodine, and the breasts are glandular, and they will expand to try and, it's the second most iodine dependent tissue, same for our prostate gland. So there are many things you can do. You could get a lifestyle, you can do a ultrasound of the breast, you can get a thermography, which all cancers have a increased blood supply so that they can grow faster in a fermentative, facultative state. They don't use oxygen, they use sugar, okay? So if you get a heat picture of your breast and you see a hot spot that shouldn't be there, then you're wondering, why is there heat in the breast of this woman at this point? And so a thermogram, breast ultrasound. There's another type of point-specific breast ultrasound, which is SureTouch, which is a pin where they kind of go around the breast in quadrants. So there's all kinds of things, but the number one thing is live a healthy lifestyle, and go from that point, and then do your own self-breast exam. Be familiar with your breasts once a month, and if you feel something unusual, have a doctor check it out. See your doctor annually for your pelvic and an exam just to make sure everything is normal, and go from there.
Great answer. Okay, well, another question that was emailed in, again talking about hormones. The question is from Ophelia and asks, what estrogen supplement can I buy to help with overall dryness? So we were talking about progesterone earlier. Now we have a question about estrogen and dryness.
Well, you can't go over the counter and buy estradiol.
Right.
Estradiol is one of 3 formats of the feminine estrogen family. So if you think of Toyota, you think of different kinds of cars that company makes, a Lexus versus a Toyota Corolla. Well, if you say the word estrogen, you are talking about a feminine type of biochemical product, but there are really 3 types. Estradiol, and that's produced remarkably high during pregnancy, so the woman doesn't have hot flashes when she's pregnant, but doesn't make the little boy baby estrogenized and doesn't make the little girl baby menstruate upon being born, okay? So God's so smart, so he makes estradiol during the pregnancy, so that's usually nothing we ever really are concerned about. Number 2, there is a dimer, so estradiol kind of flips into estrone, estradiol, estrone, estradiol. So I only prescribe estradiol because I don't want to be checking all these other things. Estradiol is the right thing, and you have to go to a doctor for a prescription for this. I use it every day of my life. I use it in the form of my creams. I have my estradiol that I make here and my progesterone. I put 1 click, to my face every day, so I have less wrinkles, and I rub my progesterone on my legs, and that's how I do it.
Does estradiol help with dryness?
Oh my goodness, yes. So that even an old lady who has long since passed, having her moisture that she produces vaginally, you can restore that vaginal moisture production with estradiol.
Okay, Ophelia, so you can't buy over-the-counter estrogen, but you can see a functional medical doctor, an integrative physician, natural doctor that can prescribe bioidentical form of estrogen, such as estradiol.
Yes.
Carry here. Okay. I have another question emailed in, this time from Gabriella, and she asks, my daughter had a baby 2 weeks ago, and she had a C-section. She is swollen and she has edema. What is the best way to take care of edema? Thank you.
Swollen and edema. Well, and if she's a healthy young woman of childbearing age, I would think at 2 weeks postpartum you would not have much swelling or edema. Mm-hmm. So I think this is something she needs to go and follow up with her gynecologist, obstetrician. Now, if she's talking about it just at the site where the C-section scar is, that's another thing. But if it's in her lower extremities, then I would worry about blood clotting. So that's something, Gabrielle, I would have the doctor take a look at.
Okay. Looks like no questions in the chat right now. Now, I do have a couple questions from someone that was submitted via email, but I just want to say, if you're sending questions that are paragraphs long and you're giving specific medications and strengths, and once it starts to get to that level of complexity, that is really something that we need to gear more towards a medical appointment, yeah. Right? Mm-hmm. We can answer general questions here. But they need to be short, and they need to be something that we can help educate on. I'm going to go ahead and kind of summarize this question here, but just to say, if we're late to get back to some of these questions, it's because the question is really too much for this particular
venue like this,
right? Yeah. So just generally speaking, this person is saying she went to go see an integrative doctor, and they prescribed several medicines, including thyroid. And she wanted to know our opinion on the treatment. Her complaints are inflammation, joint pain, dryness. She's been taking enzymes and everything that you recommend with great improvement. So these medications are in addition to all the supplements. She's in her 60s, A-type blood. So the doctor, looks like, prescribed DHEA vaginal cream, estradiol testosterone combo cream, progesterone capsules, and then liothyronine, which is your thyroid medication. So, do you have anything to say about that kind of course of action?
No, it really depends on the patient and what the doctor is seeing at the time and what the blood levels that treatment gives. Mm-hmm. Yeah, so that's not a bad layout for natural hormone therapy, but I have to get a lab on them and see their impact, and then follow up with the patient to correlate the lab with the usage and how they're doing on it, and make adjustments at that point.
Right. And follow up to that, she's also seeing a doctor that's going to be prescribing chelation, which is great, but she says she's very nervous about having chelation since she's never had it been done before, and wants to make sure that this is what you recommend. And this doctor is prescribing Editate disodium 150 milligrams per ml and DMPS 50 mgs per ml.
Yeah, that's a standard protocol for chelation therapy.
Yep.
Chelation has been around 70 years. It's been used very successfully on a multitude of chronic medical problems that people suffer from, and it always improves their microcirculation. So if you can improve the circulation from your brain to your toe, all those areas that could be problematic would be improved. Just want to point out one thing here. Now, as of last Friday, there's nearly 11,000 deaths subsequent to the vaccinations reported on the VAERS. So that's of grave concern. And there was yet another retraction from the Journal of the American Medical Association. Now the publication that I talked to you about from the mask studies about the 6 times higher CO2 retention in children with masks. Now the JAMA Pediatrics editor has retracted that study, not citing any reason why, but he just retracted it. But it's interesting, the JAMA journal is sponsored by Pfizer, so maybe that might have something to do with it. What do you think?
Okay, well, it looks like Dr. Even had more headlines to go over with you all, but I do have to get her ready for her patients that will be coming in very soon. I want to thank you for joining us today. We're here every Wednesday, 9:45 a.m. Pacific until 10:15. Sometimes we go a little bit over. Email your questions into us, office@tlcdoctors.com. And of course, thank you to all of you who participated in the chat. We love to see that. Do us a favor, we're obviously not charging anything for this, and we want to continue to do this. Share this with your friends and family. If you're finding value from the video, hit that thumbs up button, and when we push out new videos, if you subscribe to the channel, you'll never miss those, and you'll be notified in YouTube when we publish new content. So thanks again. We look forward to seeing you on Monday, 5:30 p.m. Dr. Althorpe will be here by herself, a little bit longer version, sometimes an hour plus or minus, and we'll be here next Wednesday at 9:45 a.m. Pacific. Thank you all, and be well.
God bless.
God bless.